Good morning. My name is Matt. I am the chairperson of the DRHA Clinical Research Working Group. Thank you for having us in this morning. And I wanted to just give you a quick purpose of our discussion today. As you know, clinical research is part of the mission and vision for DRHA, and that sort of came about in our reorganization in 2010, at which time we put together a research office that we opened with limited staff and some modest goals for clinical research in our institution. Over the past 18 months, we've seen exponential growth in the number of research requests, which has overwhelmed the existing resources and processes we have in place to service our community and our physicians in the institution. At the Senior Leader Retreat in early 2015, addressing the clinical research program was listed as a priority for fiscal year 2016, and the following presentation is a result of a 2-month working group on how to address the clinical research process. So the outcome of our work has basically to develop a clinical research office that is dedicated to the DRHA vision for clinical research. There is some existing infrastructure in place that we're going to build on as part of this, but what we'll be doing is revamping the entire process to give clinical research its own footprint. And what we'll talk about now is a little bit of the timeline for implementation on how we're going to address those needs. So as I mentioned, there is some infrastructure already in place, and what we'll be doing is adding some staff in early June to prioritize and offer some grant support for existing requests, also building out the physical space for the new office. In September and October, we'll be adding RN clinical staff as well as billing and administrative support to support the ongoing issues, as well as building relationships with the principal investigators that are already in existence. Evaluation is a key component of our plan, and will be going on throughout the initial rollout, but we've selected the February-March timeframe as a specific evaluation with stakeholder and leadership review, as well as decision making. We've built in a lot of flexibility in the plan in terms of staffing and how we'll be doing ramp up to address these needs. And along this whole time will be internal marketing and communication with the research community to ensure that everybody understands the changes that are being made and why we're doing that. I'm going to turn it over now to April, who is going to talk about some of the nuts and bolts of the finances.
Thank you so much, Matt. Yes, my name is April. I've been working with this group, and I'm just going to kind of walk us through the first year revenue and expenses. Let me start off by saying that research is not a profitable venture in and of itself. This is based solely on the fact that any money that we get in grant money that we don't use must ethically and legally be returned to the grantor. So I hope this doesn't deter you. But let's get into the capital expenses first. The furniture, IT equipment like computers, printers, fax machines, phones, those are all things we're going to need to start up this business. The big thing I want to look at is the software program. This is $15,000, but it includes training and a year of service for everyone in the research office. This software allows you to compile and send data that's encrypted, and it also allows users to eliminate personal identifiers, ensuring HIPAA compliance. So this single feature more than pays for the cost of the software by eliminating the need for the privacy officer checking what we're doing. Our total capital expenses come to just under $35,000. So then operating expenses, the big chunk is salaries and benefits. By year end, we'd have 3 RN clinical coordinators, 2 to start, but we definitely need to add a 3rd. This is the most important, the core of it. They work multiple jobs, and these professionals pre-screen studies before presenting them to the director to make sure they're even feasible. They communicate with the principal investigators, the billing, the IRB to make sure all the studies are billed, budgeted, and completed on time and accurately. course, we got the billing coordinator, the administrative assistant, and our research director that is already employed here. They have experience with the DRHA and the IRB, and they'll be doing the bulk of the training for all the employees. Our grant specialist is our fuel for the fire. They're the one we want to get in here as fast as possible to get the grants written, to consult with all the principal investigators to make sure they know what they're doing when they're applying for the grants so that we actually get them. And then total salaries with the benefits per month, we expect to be $73,800. We'll also have a medical consultant, an unbiased outsider on occasion that we'll need to use. We expect $2,000 to $3,000 a month. And then we have, of course, our office space that's rent, utilities, office supplies. And then the IRB basically just kind of washes through our accounts in our office. That's included in every specific grant. It goes straight through our office to them, $2,000 per review. Right now we're doing about $12,000 a month. We expect by year end to be at 10 times that at $120,000 per month. Total operating expenses for the first month at $20,000, give or take. End of year at $170,000 plus. Research expenses are the big expense. It's the money that goes towards the actual research itself. That's $11,651,000 for the year. Now our revenue, the grants, sponsored research, and study-specific clinical activity, we expect to grow from about $430,000 to over $3 million per month. And then at the fiscal year, we stay in the red with our initial capital expenses at just under $35,000. I know this is red, but there are benefits, financial and otherwise. Once we establish our reputation, Phil will explain how those benefits will come back to DRHA and the community.
Thank you, April. My name is Phil, and I am going to walk through some of the alignment if this helps meet the goals. The goal of our group was to better align DRHA and current research needs with our mission and value. Our mission is to be a regional leader in patient care, education, research, and innovation. Our vision is to be a guiding force for community health and well-being. And our values include being patient and family-centered, to treat others with respect, care, and compassion, and inspire each other to achieve greatness. We also want to be the standard by which others benchmark their quality patient care. The current system has raised several issues that have been addressed in this proposal. With a team devoted to clinical research, we will gain a standardized recruitment and consent process, one area to request and control access to DRHA patient information. We'll have a research business specialist dedicated to coordinated funding, billing, and budgeting needs. And we'll have a trained, dedicated staff and manager to facilitate all research from request to completion. We'll have one source for working with research regulators and the IRB. The clinical research is an important part of DRHA to help improve patient care and outcomes. A clinical research department aligns our needs with our strategic plan of financial stability, research, quality care, and lifelong learning. An investment in our proposal would allow a dedicated office and staff to build a strong relationship with our clients, our clinicians, and our community. Next, Leslie will discuss how to involve the community.
Thank you, Phil. Good morning, my name is Leslie, and I'm an RN marketing member of the work group here at DRHA. I'd like to talk to you just a little bit about how we chose our marketing plan. Caratco describes in 2015 that the relationship between marketing concepts and a business plan involves examining marketability. Determining marketability incorporates a market analysis to identify the target group or customers to reach, the opportunity to engage this target group, and identifying the potential accomplishments and risk involved in pursuing the planned business. A healthcare business plan may be successful without a marketing strategy. However, developing a marketing plan ensures an increased chance of success. As mentioned earlier by Phil, the vision and mission of DRHA is to be the guiding force for community health and well-being through leadership in patient care, education, research, and innovation. According to the CDC 2015 data, the top 2 causes of death in the United States remain heart disease and cancer, respectively. This information was utilized to establish a community target market for the DRHA Clinical Research Office of Cardiology and Oncology patients for participation in the ongoing research. Therefore, this will be the focus of the community campaign that will be executed through the distribution of the presented brochure. Distribution will begin in the hospital setting to all the admitted patients, as well as the clinic setting with the distribution to all outpatients. The DRHA research website that is noted on the brochure can be utilized to offer more specific information regarding the trials available for community participation. Recent marketing information by the Bloomberg Business Online in 2014 identifies the age 35 plus or middle-aged crowd as a group that responds to specific type marketing. Bloomberg goes on to recommend the use of YouTube, Facebook, Twitter, Craigslist, and Backpage social media linked back to the research website as a successful way to engage the target market as well. These are cost-effective and generally easy to develop and maintain, making them an appealing option for a new venture working with limited capital. Sharon is going to show you the marketing piece the group has developed now.
Thank you so much, Leslie. Hello, I'm Sharon. I'm excited to share this brochure that's going to be available everywhere in our hospital, outside the hospital, in doctor's offices. I'm really excited about it. And it says that, let me get it up here for you. Okay, so you should see the brochure here on your screen. And the first thing that people are going to see is at the center of our research is you. Here at Desert Regional Health, we understand you. People who have the desire to participate in research that has the potential to prolong their lives need a hospital where their needs are put first. Here we put your needs first by taking all of the frustration out of participating in a clinical trial. We have provided a one-stop service with doctors, nurses, and researchers that are compassionate and that care about you. So this is what the creation of this research office is going to do for us. Desert Regional Health presents Research with a Focus on You, a brand new research department with easy access and streamlined processes that make it easier for patients who want to participate in clinical trials and research. This new department will also allow us to participate in more research so that we're better able to serve you. And then we're going to go down to the next part of the brochure. In the middle, it just talks about our missions and values as laid out perfectly by Phil. But then again, at the bottom, we're going to say we want to reach you. We are currently reaching out to patients that are suffering from cancer or heart problems that are not able to have surgery. If you feel that this describes you or a loved one, contact us. If you're in the hospital, you can find further information on our hospital intranet. Click on the Research for You icon at the top of the screen. And in the middle of the brochure, here we provide access, how we provide access for you. So this is going to talk about the ways that we're providing access. You can easily reach us by stopping at the concierge desk in the main lobby of the hospital. You can visit us online at www.drharesearchforyou.org. And then we're going to have a 24/7 nurse line devoted and dedicated to research here. And that number is 1-888-YOU-DRHA. And in this helpline, they're going to be able to report anything related to their research participation and find out about any other research or clinical trials that the hospital is currently participating in that they may qualify for. We have provided these services to make sure that we're able to be there so that we can provide the care that is needed by you. I want to thank you for listening to our marketing approach. And if you have any further questions, we will remain after the video to answer them. Again, I thank you everyone for being a part of this dynamic team, and I hope that we've answered all your questions regarding our marketing strategy for this research department. Thank you.